opportunity for 5 minutes.
Thank you, Mr. Chairman. I want to thank our witnesses for being here and testifying today. By quick show of hands, very quickly, how many of you think that Medicare fraud only happens in blue states? Let the record reflect that nobody raised their hand. And how many of you, by show of hands, think that it happens in every state? Let the record reflect that everybody agrees it happens in all states. There are many unscrupulous actors all over the United States, and in Texas is one example. The HHS OIG found that a hospice executive was guilty of falsely enrolling Alzheimer's and dementia payments, telling them that they had mere months to live. Now, end-of-life care is very personal to me because I was a caregiver for both my father and mother who died from Alzheimer's. And it's unfortunately one of the most common diagnoses for patients who have elected the hospice benefit. And I can tell you that the hospice benefit is a critical support not just for the patient but for their caregivers who have a huge burden. But that benefit needs to be updated because over the past 10 years, public trust in that benefit has eroded. Currently, hospices are paid for each day of care, whether actual care is even provided. Now, a few weeks ago, when we've been talking about let's do some solutions, I introduced the Hospice Care Act, and that legislation cleans up rampant fraud in the industry and reforms the payment system and enhances the benefit for families and their loved ones. Ms. Clark mentioned in her testimony that California's beneficiary notification letter has been effective, and that seems like a pretty simple solution to me. Dr. Yanni, who has personal experience with this, what state are you from, doctor?
The experience happened in California.
And would it have been helpful if you had received a notice from CMS notifying that you were enrolled in hospice care?
Absolutely.
Excellent. I'm glad to hear that because my bill requires the secretary to provide notice of the hospice election within 15 days. Now, that one policy change isn't going to save the entire industry, but it's one of many reforms included in the Hospice Care Act. And there are many other reforms that Ms. Clark noted that I was excited to see that I actually agree with. Things like temporary enrollment moratoria, enhanced and more intensive screening of new hospices, increased survey frequency for flagged hospices. Ms. Clark, you weighed in on the Hospice Care Act last Congress when Mr. Blumenauer introduced it, isn't that right?
I did to his office specifically, yes.
And do you think there's anything in that legislation that is politically divisive?
No, I do not.
Thank you. You know, my Republican colleagues and I disagree on a lot, but I have often found that there is usually consensus and agreement in issues of health care, and this issue should be no exception. Medicare fraud is not a red state versus blue state issue. It is a very troubling issue for all of our constituents. That's why when I redrafted the Hospice Care Act, I reached out multiple times to Republicans to work to try to find a path forward. But rather than working across the aisle to legislate on an issue that we both agree is a very pressing issue, it seems like Republicans are only using fraud as another political football. I hope that my colleagues on the other side of the aisle will see the need to move forward on the Hospice Care Act. So instead of just bellowing about waste, fraud, and abuse, we have a chance to actually implement policies to combat fraud. And with that, I yield back the balance.